Hi, I am Dr. Vidyadhara S, consultant and spine surgeon at Manipal Hospitals, Bangalore. I head the department of spine surgery for the last 12 years. It is one of the oldest and dedicated spine centers that you see in the city of Bangalore. We cater to all the spinal problems starting from the occiput to the tailbone, and it can be age related, birth problems, tumors, infections, deformities, and miscellaneous things. We have wide spectrum of treatment modalities starting from medications, physiotherapy, exercises, neuro rehabilitation center, and also invasive interventions such as epidural steroid injections, transforaminal nerve root blocks, and an extension and a useful arm of a varied variety of surgical interventions in spines. We have still believe that most of the medical problems in spine can be dealt with medications, exercise and physiotherapy and lifestyle modifications, but still, having said that, we have adopted to the need of the technological advances, and we have state of the art operative setup which can cater to advanced spinal surgeries, and we do routinely cervical spine degenerative disorders with microsurgical decompressions, discectomies, artificial disc replacements, anterior cervical fusions, posterior laminectomies, foraminotomies, and tumor excision surgeries in the cervical spine. In the thoracic spine, we deal with a lot of deformity work in the form of correction of scoliosis, correction of kyphosis, and kyphoscoliosis. We do perform a lot of spinal osteotomy surgeries and fusion surgeries. The scoliosis can be seen in children as early as at birth, which is called as congenital scoliosis, which can be dealt with by either bracing or by small surgeries such as hemivertebral excision and convex hemiepiphysiodesis, or in juvenile scoliosis, wherein age group between 3 to 10 years of age, we can do growth rod insertion and serial distractions on a yearly basis, or we have option of adolescent idiopathic scoliosis being treated with one-time posterior spinal scoliosis correction and fusion surgeries, and also anterior spinal scoliosis correction and fusion surgeries, and a combination of both if and when required. We also deal with adult spinal deformities, which includes degenerative scoliosis in elderly or adult population. We have intraoperative neuromonitoring, which is a useful tool to detect neurological deterioration while correction of these spinal deformities at the earliest during the surgery, so that things can be reversed at the earliest. The spinal kyphosis, which is the backward hunchback, can be also treated with various modalities of surgeries like ponte osteotomies, vertebral column dissections, or closing opening wedge osteotomies. And we have an expertise of doing more than 1,000 surgeries in the last 12 years in this Manipal Spine Care Center. We also cater to a lot of patients with spinal fractures, either in the younger people, wherein we do spinal stabilization and fusion surgeries, whereas in elderly we have injection of bone cement in the form of vertebroplasty and kyphoplasty, which is a daycare procedure which supports the spinal fractured bone and gives instant pain relief to the extent of 70 to 80%, so that patient is ambulant. We also deal with lot of spinal tumors because Manipal has got a comprehensive cancer center, and metastasis to the spine is the commonest among the metastasis secondary to any cancer. So we deal with these tumors, and we have a team of radiation therapists who can post-operatively give radiation so that the cancer is completely cured. We do encounter a huge number of spinal infections, either primary infections like pyogenic or tubercular, or secondary to spinal surgeries, and we have always believed that spinal infection is a medical disease if biopsied and treated adequately, appropriately at early stage, and if it is causing compression of the nerves, it needs a decompression on stabilization surgery followed by antibiotics for adequate length of time. We at Spine Care Center deal with patient symptoms, patient's examination findings, correlate them with the investigative modalities to come to an accurate diagnosis, which is the key to our success. We have meticulous workup of all patients, including cardiac workup, the neurological workup, the physical fitness, and before we jump into any surgery. Our success rate is a testimony to our meticulous approach to the problem, and we have a success rate of over and above 99% consistently for the last 12 years of our presence in Bangalore.